My name's Dave Redman, and I'm retired. I retired fully in 2013, but prior to that, I did 27 years in the military as an officer in the Canadian Armed Forces, Army specifically, and then did another 5 years with Emergency Management Alberta. And then for about 7 years after that, I did consulting with federal government, provincial government, the U.S. government on emergency management.
So what exactly is emergency management for someone who has no idea?
Emergency management is a disciplined process that constantly looks at all the hazards that could potentially affect the jurisdiction you're in. So it's based on an all hazards approach. You're constantly monitoring the hazards. You have full mitigation plans for those hazards, but then mitigation isn't always perfect. So the second function of emergency management is preparedness. So you write plans, you organize agencies, you build capability so that you can respond if your mitigation fails. The third function is response. So when something bad does happen, you've got the pre-planned plans, you adjust them for the exact hazard that's coming at you, and you respond in a pre-planned and systematic manner to address the emergency. And then the fourth function is recovery, because you always know that at the end of it, there's going to be damage done, and you have to recover, whether it's your economy, whether it's a personal challenges, all of the different things that can happen in an emergency. You then rebuild afterwards, and that's called recovery. So it's mitigation, preparedness, response, and recovery, but it's a discipline made up of 5 dimensions, and the intent is always to be ready, but ready to respond.
Now, what kind of projects have you worked with in the past, and have you worked with the government before?
Of course, in the past, in my military career, I worked all over the world. I was responsible for the closure of Canadian Forces, Germany, Europe, the technical closure, which was basically bringing home 18,000 Canadian citizens, about 7,000 of them soldiers, but all their families and their children, closing our schools that we were running, everything there, and closing out that small city of 18,000 people. So that's where the ideas of running an operational planning process to break down a huge problem like that into bite-sized pieces and then delivering it. Following that, I was posted to one service battalion here in now Edmonton, first of all in Calgary, and during that posting I was responsible to take the service support unit into the former Republic of Yugoslavia. 1 month after we arrived, the Prime Minister of Canada at the time ordered that we withdraw all Canadian forces from the United Nations peacekeeping operation in Yugoslavia. So my mission changed from one of supporting all of our deployed assets to bringing them all out. Again, scrubbing them to Agriculture Canada standards, bringing all of the equipment out, running the airheads, the seaports, the roll-on, roll-off ships, and bringing all of the assets out in the middle of a raging war, the 95 war in Yugoslavia. At the 11th hour, we were literally to get on the plane on the 23rd of December and fly home. On the 13th of December, my mission changed, and so did my soldiers. And we were ordered to bring back in a NATO Canadian commitment. And so we switched roles, and we accepted ships and planes, and we reestablished bases in central Bosnia, again, still at the tail end of that war, but to bring the Canadian forces back in, but in an armed fashion as opposed to a UN fashion. So again, learning how to use the operational planning process to adjust to emergencies and to take immediate action in a responsible way. After that, I ran the largest school in Canadian Forces training system and trained officers to be officers and soldiers within their crafts and trades. But then I retired from the forces in 1999, right before September 11th, 2001, and I was hired by Emergency Management Alberta. In my first job with Emergency Management Alberta, I was to run what's called community programs, which is helping the 314 municipalities in Alberta to prepare for an emergency. So make sure they had mitigation preparedness, response, and recovery in place in their communities. On September the 11th, we all know what happened that horrible, tragic day. And on September 12th, Premier Klein formed what was called the Task Force on Security, made up of the 10 deputy ministers of the government of Alberta, but what I called the 26 brightest minds in our province. They were brought together by the Premier. And he asked one question: what changed today? And my role completely changed. I stopped being the director of community programs. I was brought in originally as a plan writing expert, but within days I was assigned the task of writing the Alberta Crisis Management Counterterrorism Plan. And first to write it, which was done by November, and then to implement it over all of Alberta, the private sector, which is a huge part of that plan, and the public sector. And we did that over the next 2 years. At the end of that, I was placed in charge of all of Emergency Management Alberta, so I took over the entire department and then responded with the government to all of the hazards that happened from 2004 till I retired in the fall of 2005. And so worked things like the major floods and the huge forest fires that happened in those years, working directly to support confidence in government with our Premier, but while doing the mitigation, preparedness, response, and recovery for each of those major emergencies.
So with your experience then, do you feel like with the current emergency that you've got, say, the credibility to be able to weigh in on it?
I would hope that people with my type of experience, both the military, but in particular the working with the provincial order of government in emergency management, would have been the type of resources and assets that the government would have looked to if they had needed them.
So when you saw the beginning of this COVID, as COVID came into the province, can you describe your initial reaction to the reaction of the government and then what we saw in policy?
In February, I was watching, like I think most Canadians were, on my smartphone. And people say, you know, that things came as a surprise. But every night on my smartphone, all I would do is type in, at that time, coronavirus, name of country, deaths by age. And the data was all there. And the data was never ending. And it said very clearly that 95% of all the deaths that were happening worldwide up to February and into early March were in seniors over the age of 60 with multiple comorbidities. Now, a comorbidity is something that will kill you if it's constantly not monitored and treated. So with that kind of a knowledge, my expectation was that the government would immediately pivot to trying to build a plan to isolate our seniors in concentrations that were over 60 with multiple comorbidities. Now, to me, it's a no-brainer that that's our long-term care homes and seniors type homes, that whether they were in hospital, but particularly the separate ones. To build a quarantine plan for them would have been relatively easy, and I couldn't understand why it wasn't. In fact, a friend of mine and my son, in the middle of March, built one sitting in his living room one evening with scotch in our hands. The concept is pretty simple. You take the staff, because you have to quarantine both the staff and the residents. And you have to do it in a humane, civilized way that the residents actually are treated better during the quarantine than before the quarantine. But you take the residents, you put them for 14 days in isolation in a government-run hotel with their meals and accommodation provided. You then use a quarantine bus service to move them back and forth to however many of the long-term care homes that they're going to work in. And they do that for 30 days. At the end of 30 days, they go home to their family. And the second shift is quarantined for 14 days in advance, and they take over for 30 days. You and I know it. It works in the oil sands. We do it all the time. The oil sands workers, most of them don't live in Fort McMurray. They do a 30-day shift in, 30-day shift out. You could have done exactly the same with long-term care homes. We know today that out of the 20,900 deaths that have happened in Canada, 75% of them happened in long-term care homes across our country. That means 15,000 of the 20,000 deaths never needed to happen. If suddenly we're talking about COVID in Canada and it's 5,900 deaths instead of 20,900 deaths, we're talking a different story. We knew that in March. So in March, when I saw our province pivot to a lockdown, a non-pharmaceutical interventions philosophy, which time and time again has been proven to be ineffective and not the way to do it, so much so that there are complete lessons learned and complete planning documents that say, don't do this. When I saw we pivoted to that type of non-pharmaceutical intervention instead of a quarantine of those most at risk, I was dumbfounded. I couldn't believe it. And so for about 15 days, 16 days, I watched the news and I was horrified, absolutely horrified. I then picked up my pen because I couldn't help myself anymore because I want to be retired. I do not want to work. But I wrote to the Premier and explained to him exactly what I was seeing and what should be done as opposed to what was being done. And I wrote him a comprehensive letter and explained how the mechanisms work, that the emergency management organization should have been placed in charge. Health should have been looking for surge capacity and helping to build the quarantine plan for our seniors, and that clearly wasn't happening. What I couldn't believe was that we closed our schools, which is a non-pharmaceutical intervention strongly deterred against in all of the previous plans. That we were locking down our business, strongly discouraged in all previous plans. That we were telling people to isolate in their homes. Every one of those types of activities, all of the non-pharmaceuticals, we were sending home healthy people. People, if someone would walk into an organization and someone in their family had tested positive and it became known, we would send all the healthy people in that organization home. Self-isolation of people who've been exposed but not actually sick, totally against all of the non-pharmaceutical intervention. We did everything that we were told from previous hard lessons learned not to do, we did them. So the damage to the education of our children, the damage to our small business, the damage to people's mental health, the damage to societal health all started. But we could have stopped it. We could have stopped it in April if we turned the corner and said, no, we're going to follow a confidence-based approach instead of a fear-based approach. Because what happened right at the start, in my opinion, is the medical officers of health in all 13 provinces and territories in Canada were placed in charge. And they pivoted to a mission statement that is, we will protect our medical health care system. When the mission should have been, we will cause minimum damage to our province through COVID-19. Two completely different mission statements. But when you place the medical officer in health in charge, that's what they know. Protect the medical system. Protecting the medical system has destroyed the mental health, the societal health, the education of our children, the effects on other serious diseases like diabetes, cancer, and heart disease. Those three people have been abandoned, so much so you're now seeing ads on TV all across Alberta from the Heart Association and from the Cancer Association begging people to go to the emergency if they have symptoms, because instead of going to the emergency, they're dying at home because they're terrified of catching COVID. So we've created long-term illness, societal impacts, mental health, the education of our children, and let's talk about doubling the national debt of our country. If we don't think that doubling the national debt of Canada isn't going to have 2 decades worth of impact, then we're living in a dream world. Because when you double your national debt, there's simply less money to transfer provinces for healthcare, for example, for the next 2 decades. We have approached this in a manner using non-pharmaceutical interventions that was completely dismissed and strongly urged against by every organization in our international, our national, and our provincial plans. It said, don't do this. But by placing the medical officers of health, they went to what they knew. They've now, it's called mission creep, they've now gone even away from protecting the healthcare system. It's very clear from what you see on the news every night in all of our provinces in Canada, they now believe that the aim is to make sure no one catches COVID. It's impossible. It's an endemic now. It's not a pandemic. It's in our society. All the new variants. Why did it come as a surprise that viruses mutate? One of the things the medical officers of health in every country in the world should have been doing was actively looking for mutation. Because when it mutates, it can make your vaccines totally useless. It can cause an increased spread. If you're chasing case counts, you're chasing the wrong thing. Number one, healthy people should be at work. But number two, by not looking for those changes, it now comes as a shock. And again, it makes a great fear campaign, but it really doesn't make any difference in what you should be doing to respond.
So when you look back, because you talk about plans that were already in place, what were those plans? Did they have access to those plans? And why do you think they went that way? Nationally,
there is a pandemic response plan for the federal government. And in every province in Canada, there is a response plan. I'll give you the example of Alberta. It's dated 2014. You update your emergency plans once every 10 years, so it was due for review and rewriting. I knew about it simply because I was the lead of the emergency management team that wrote the 2004-2005 version, which was then updated in 2014. It's still on the Government of Alberta's website. You can download it. And it has 4 goals. The first one is to stop the spread of the disease and to minimize death. That's goal number 1. Goal number 2 is to stop the societal disruption caused by the disease, and in particular, to assure critical infrastructure. We have a power grid, we have natural gas to heat our homes, we have water supply, making sure those things are sustainable. So that's goal 2. Goal number 3 is to ensure the minimum economic impact on your province, Alberta. And the last one, to ensure an effective and efficient distribution of resources during the pandemic and the recovery. 4 goals, we failed at all 4. Okay? If we were trying to minimize the impact of the disease on death, why didn't we isolate our long-term care homes? We could have saved, out of 7,000 deaths in Alberta, we could have saved over 6,000 of them. So we failed at the first one, and we completely ignored the other 3. You can't tell me that we believe that we've done the minimum economic damage to our province by what we've done. And that's what happens when you use non-pharmaceutical interventions. It's going to cause all those other disruptions, and that's why they're so strongly recommended against. Because to overcome mental health, societal health, education of our youth, collateral damage to other severe diseases, and your economy, you don't use them. But we've got those 5 in spades now. Think about the people who have committed suicide, are extra drug overdoses caused by a campaign of fear. That comes out of lockdowns. If you had followed a campaign of confidence saying, we've built surge capacity in our hospitals, folks, we're ready for this disease. We've quarantined our long-term care homes, and look, we've got the lowest per capita rate in the world. We have assured that our economy has stayed open to the largest extent possible. We've only imposed very, very minor limitations on our industry, and our economy is continuing to do well. I'll give you an example that people immediately want to attack me for, but I use it intentionally. Sweden. Sweden has not followed all the rest of Europe in terms of following the lockdown mentality. They discouraged the use of masks, and only recently, since the 1st of January, suggested, not regulated, suggested that you might want to wear them on rapid transit. Otherwise, you don't wear masks. So, no mask wearing. They strongly, they have kept their whole economy open. Some industry has chosen to close because of lack of customer demand, but not at the order of the government, ever. They don't believe in anything like a curfew. That to them, that's unimaginable. They have kept all their schools open, except their senior high schools, 16 and over, for 2 very short 2-week periods, one in the spring and one over Christmas, an extended Christmas break. Schools open, no wearing masks, industry open for business, and the whole concept of NPIs not followed. They have a lower death per capita than Quebec. And we know what Quebec did. Mass lockdowns, curfews. So how can you tell me lockdowns are working when this country that followed no lockdowns has a lower death per capita? In fact, let's come back to Canada. Out of the deaths in Canada, 20,900 deaths. 96.4% are in seniors over the age of 60 with multiple comorbidities, average age 84. So let's talk about the people under 60 with no comorbidities. We've killed a total of 750 at this point in time to COVID. Under 60, most had comorbidities. But even if you just take 750, 1,200 Canadians die every year under the age of 60 in car accidents. Did we lock everyone in their houses to stop them driving their cars? There's never any context given. When a medical officer of health talks, in Ontario, for example, at the peak, they said, we've got 1,700 acute care beds filled with COVID patients. Our hospital system is being overwhelmed. What they never bothered to say is there's 22,358 acute care beds in Ontario. 1,700 out of 22,300. So it wasn't COVID that was overwhelming the hospitals. Something was, but it wasn't being talked about. They were using COVID to try and justify the fact that they hadn't built surge capacity to handle perhaps an extra large number of patients. But it certainly COVID wasn't overwhelming it when you've only got 1,700 cases out of 22,000. We were never given denominators. We're not getting anything in context. It's intentionally not given in context for the simple reason that that would destroy the campaign of fear. They want people to want to stay home. Because that serves the agenda of preserving the hospital system. A 16-year-old sent me a drawing, and in the middle is the medical officer of health standing in front of a hospital with light beams coming out of it saying, protect our healthcare system. Surrounding it, behind it, is a massive body bags of all the seniors from long-term care homes. So the little sign says long-term care home deaths. Over here, mental health care deaths, societal deaths, the entire concept of economic devastation with the buildings on fire of all of our small business and all of the other things, and our interrelationship between provinces with big roadblocks across barriers between provinces. Capsulated in one cartoon by a 16-year-old, the complete concept of what we've done wrong and its impact. If instead we had shifted and quarantined our long-term care homes, we would have removed 75% of the deaths right away. And now we're talking about 5,000. What should we have done next? We should have looked for everyone that had multiple comorbidities. And family practice doctors will easily identify those to you. They know the people who are currently in their care who have dementia, heart disease, and some kind of a heart condition. They would have been able to identify them, and we could have targeted money to either quarantine them in their homes with one or two of their primary caregivers, i.e. family members or somebody else, or we could have, if we had protected our long-term care homes, offered them space in similar to long-term care home facilities in either a hotel or some other kind of facility that we would have established to try and gather them in a fun and humane way into a quarantine situation to protect them. And we could have flattened down to 3% deaths from COVID instead of 100% deaths from COVID. Because if 96.5% of all deaths in Alberta and in Canada, seniors over the age of 60, multiple comorbidities. Why didn't we protect them first? In emergency management, your number one task. Here's your hazard, here's your target. The target was clearly seniors. Everyone else catches COVID and recovers. There's a tiny percentage, yes, that will catch COVID and it may kill them. But I'm sorry, bad things happen to really good people all the time. You've got a greater chance of walking out that door and being killed in your car driving back to Calgary than you do of catching and dying of COVID.
Did Kenny write back to you?
I was written back only by one premier, and it was never Premier Kenny. I was written back to by the government saying that they had sent the first letter was sent to the Ministry of Health. I wrote back immediately saying, that's the wrong person. Please give this to the Premier. I never heard from them again. My third letter, I got an answer back, said emergency management has matured significantly since you've retired.
And what's your thought on that? How do you make sense of what's happened with the people who say were in your role, or in your role now?
They were dismissed. The medical officer of health was put in charge. The Premier put the Minister of Health in charge. The medical officer of health took responsibility and took control of the situation, and that discussion was over. The EMO, if they were involved at all, were dismissed and said, if she needs you, she'll call.
You've had critics. What have they been saying?
The biggest number of them constantly want to try and discuss whether or not there would have been more deaths if lockdowns hadn't occurred. And first of all, everything we ever learned before, and the reason why we wrote our plans the way we did, and the reason why WHO produced that 2019 document to say don't use non-pharmaceutical interventions was we already knew this was the wrong approach. But since then, a group of extremely well-founded doctors have published a paper in late December, studied the first wave completely, and what they studied was countries that did no lockdowns, Sweden being one of them, but there are many others, and countries that did severe lockdowns. And what they tried to find was a difference in transmission rate. They weren't looking at deaths, they were looking at transmission. And what they discovered is there's absolutely no difference between the transmission in lockdown and non-lockdown countries. So when we're constantly being told, well, more people will catch it, it will overwhelm our medical system, the truth of the matter is that didn't happen in non-lockdown countries because the virus acts the way the virus does. In northern countries where people go in wintertime into their homes, you see that large curve that goes straight up until about the middle of January. It peaks, it drops off, it carries off on a flat, and by middle of April it starts to drop down and it disappears for the summer. And that curve is exactly matched in countries that followed non-pharmaceutical interventions and those that didn't. So that's the main attack I get. I get that, well, look, Sweden did much worse than its Nordic neighbors. Very true. You can always spin a story if you put one piece of truth in the middle of a great big story. What they don't say is Sweden has done way better than Italy, Spain, France, UK, Belgium, and even Switzerland, all who followed hard lockdowns. But if you want to pick on why they did worse than Norway and Finland, because Norway and Finland protected their long-term care homes and Sweden didn't. Okay, sir.
So let's get, where are we today? Where are we today, and what do you think needs to get done?
Okay, and I've constantly said this. Until you can vaccinate all of the long-term care home residents and their staff, we need to quarantine our long-term care homes. Any that aren't in that situation, while still watching to see if one of the shifts in the virus makes us need to re-quarantine all of them, because they're the ones that are being targeted by this virus. So step 1, quarantine the long-term care homes. Step 2, reopen the economy, remove the non-pharmaceutical interventions we've done, and do it in a fairly rapid manner, because now we have to pay for and somehow recover from the massive mental health that we've done. We need a plan for mental health to get out of this. We need a plan for societal health to get out of this. We need to find a way to undo the damage we've done to the education of our children and their social development. We need to make sure that we're ready to handle the extra cancer patients, people that are suffering from heart disease, people that are suffering from diabetes, people that are suffering from dementia that aren't in our long-term care homes. Build a plan for each of those areas, and we need to figure out how the heck we're going to recover our economy. So my thing is 2 pillars, but it's all based on removing the campaign of fear first. You've got to remove the campaign of fear and turn to one of confidence. And I've written specifically how to rebuild confidence to every one of the premiers. I sent them a briefing note as recently again as February, but I told them the same thing last April. And rebuild the response based on confidence. Confidence that our healthcare system isn't going to collapse. It never has, and it's not going to. Because we're going to build surge capacity, both in infrastructure and personnel. We've had a year to do this, and yet somehow the only way we thought we could build surge capacity was stopping other treatments and other surgeries. Absolutely preposterous. You never do that. You build new surge capacity based on new capability. You don't destroy the lives of others for COVID. We've chosen winners and losers. We've decided that only COVID patients matter. No one else does. That's why we've got the mental health problems, the societal problems, the economic problems, the education of our children problems, and the increase in deaths in the other diseases.
What do you think of the slogan, "We're all in this together"?
I believe that that's completely untrue. Half of our society is still going to work today and has seen absolutely no serious impact from COVID. The other half of our society we've forced to go and live in their houses. So there's a complete disparate response happening, and the impact is much more severe. People, I can't understand how people actually think that locking themselves in their house is helping their neighbor, because number one, that we've shown before COVID and during COVID with major medical studies that the spread of COVID has nothing to do with the lockdown or no lockdown. It follows the seasonal curve. It just does. And I'll show you've got the graph, but it's clear that we're not helping each other. Helping each other would be to keep our economy going so we can pay for the damage done by this disease. And we knew that before. We knew that sustaining your economy through a pandemic is the way to get out of the pandemic with the least damage. And Sweden, for instance, they've seen a 2.8% drop in their economy. But all of Europe has seen a 6.8% drop. Sweden's coming out of this best of all their European partners. It's a known fact. It was known before. And yet somehow we completely threw away all the lessons learned that were learned the hard way, and now we have to relearn them again the hard way. I believe that we shouldn't be restricting travel anymore. And every document and every plan prior to the pandemic says, in the first 30 days, you have a chance to slow the progression as it arrives. But once it's in your country, you're now in an endemic situation and you can't slow it. And so any actions that you take, the non-pharmaceutical interventions that you're taking to try and stop the spread of the new variants, if they're in your country, we're exactly where we were in March. We saw them arrive in the first weeks of March. We had 2 weeks to maybe do some actions to try and slow them for the first little bit, but once they're in, they're in. And anyone who says Canada and our border crossings are closed doesn't understand the basic fact that 30,000 trucks a day, every day, in the pandemic, before that it was way bigger, during the pandemic, Transport Canada knows 30,000 trucks a day cross the Canada-US border. If they didn't, you and I would already be dead because they bring food for our food supply system. 30,000 trucks being our medications, but mostly our foodstuffs. We have a just-in-time food delivery system in our country, and it's based on getting products out of Mexico and the US and all over the world. So all those truck drivers are driving back and forth. Our border's not closed. There was an article in the paper today that something like 8.7 million people have crossed our border since this started. The only people we've stopped traveling are people that are traveling for tourism and holidays. We haven't stopped the industry that has to keep running in order to keep us alive. So I simply don't understand how people don't understand that we're not really locked down. And every single person either has to go out and buy food or has to have somebody deliver food to their home. Well, when you go out, you walk out into the world, and the world's got COVID. And that's why the seasonal curve is exactly the seasonal curve. But even if you believe that you've locked yourself in your house and you never leave and your food is delivered, you've just ordered someone else to go to work. Because now somebody's got to bring you your food. So you think you're better than that poor person that's bringing you your food? The whole part of it that we're all in this together means we should be all in it together. We should be living our lives, and we should not be seeing the mental health disruption caused by not being able to walk up to somebody and shake their hand and to greet them as a human being. The damage we're doing is psychological in so many ways, and it's going to be with us for at least a generation. 10 times more harm caused by non-pharmaceutical interventions than any possible gain, if there is gain. If I was in charge today and I could get one premier, I don't care which one, if I could get one premier to follow my lead, I need a premier because he was elected. And as a bureaucrat or as a soldier, I always knew I worked for the government. I need one premier who will tell the public we're ending the campaign of fear. And what would I do? I would take their province's emergency management organization. I would put them in charge to run across all the sectors of the economy, to measure right now what the impact of COVID's had on those and be ready for a plan to reestablish every one of those sectors. I would have them immediately, within 36 hours, hand me a plan for the quarantine of all the long-term care homes in that province. And then I would expect them to have it in place within 7 days. I would then demand that through the family practitioners, we knew and were able to develop a list of all those who have multiple comorbidities, 3 or more. And we would develop a plan within 36 hours how we were going to quarantine them until they're all vaccinated with a vaccine that's good for all new strains. I would then turn to all of the sectors of the economy and say, we'll be open for business in 7 days, so that we don't see the panic mode that we're now seeing here, for instance, in Alberta, where for a whole week they're told they're not going to open, and then suddenly they're told they're supposed to be open tomorrow. I would give them 1 week notice. We are opening all the sectors of our economy, and here's our social distancing rules. Sweden's social distancing is 1 meter, not 2 meters. 1 meter is achievable in almost everything. Restaurants, bars, a 1 meter socially distancing. There is no need for masks, but you may wear one if you choose to. But it's not required. We are going to open every sector of the economy, and we are going to actually listen to our municipal order of government, who've been completely ignored through this entire response in every province. We're going to bring them as full partners into the table, so they're not surprised what we're going to do next, and they're going to help us with the reopening plan that's going to happen in 7 days. So I would take the EMO, make it the cross-government coordination team, and I would assign a very clear list of tasks to the MOH, which are medical related, which were known before the pandemic, but which I've also already sent to the premiers, a complete list of what should the MOH really be doing instead of trying to run a province. Schools immediately open and guaranteed to stay open. Daycares immediately open and ordered to permanently stay open. You can't return the economy. Half our working parents need daycare for the children in order to go to work. we're going to make sure we do everything we need with the 1 meter social distancing and with appropriate hand washing, the basic things that we saw Sweden doing, but we're going to open all our schools and guarantee they will stay open. Now, I know what we built is we built such a fear complex in the schools now that the parents of the children, 1/4 of them won't send their kids to school. So the final pillar of all of this has to be a daily, concentrated campaign of confidence to explain why we don't need to social distance more than 1 meter, why it's okay to hug your neighbor, why you should feel free to go out. You know why? Because you have a 99.99% chance of recovering from COVID. It's exactly like any other pneumonia. It's exactly like all the other diseases. If you're healthy and you have no comorbidities, the chance of you dying of COVID is almost zero. So why this campaign of confidence? Because based on all the data we've got to date, we just really didn't need to what we've done. And here's what we're going to do. And we're going to do it because you're not at risk. I'm not at risk. Unless you've got multiple comorbidities, you're simply not at risk from COVID. You might get sick, but Iceland, if you look at the studies that were done in Iceland, Iceland needs tourism to survive. Otherwise, they starve to death. So after the first wave, they did massive testing. They went out and did what we've never done. They tried to determine how much of the population had COVID and never even knew they had it. What they proved is 43% of the population of the towns and villages they studied had COVID and never even knew because they were totally asymptomatic. There's another 37% that had such minor symptoms like a headache, a neck ache, or an occasional dry cough, and I mean occasional. 80% of the people never even reported the hospital because they didn't even know they were sick. The last 20% is where you started to find varying degrees of people that had flu-like symptoms and then worse, and then finally the little last 1% that ended up in hospital. So the moral of the story is COVID is no worse than pneumonia. And if we had and we have pneumonia in our country every year. Did we lock down our economy every year? It's no worse than pneumonia. And people say, yes, more people died of COVID than did of pneumonia. Absolutely right. We lose 8,500 people every year. We've now lost 20,000. But all of the ones who died shouldn't have if we'd quarantined our long-term care homes. 70%. I'll take you back to 5,900 that weren't in long-term care homes. Compare that to 8,500, right? The whole point is, if we'd taken care of those most at risk, long-term care homes and people with multiple, and I mean severe multiple comorbidities, we would have had a death rate in our country maybe of 200.
Behind closed doors, have you been contacted by other people in emergency management, some of your peers in the past or military?
I've been contacted by military people, but just to laugh at my mustache on TV. I've had many people from the EMOs who have had their jobs threatened. They've been literally, and I have emails from their bosses that they've shared with me, one more word out of you, you're fired. Anyone who goes against the MOH's rule, you can't bring up a second opinion. So yes, I've had many, many emails from EMO members. I've had many, many emails from doctors, madder than hell, because they don't believe what the MOH is doing. And these are specialists in all of the major diseases, but also in family practice. Madder than hell at what we're doing, because they see every day the impact this is having in mental health issues, societal issues, the children that are coming in front of them with severe problems now because of not being able to go to school and socialize and develop. And the economic, people don't understand that bankruptcy is not about money. It's about destroying a family and all of their friends. When someone goes bankrupt, they take down a whole world with them. The mental health issues and the societal issues that are going to come out of the, 180,000 bankruptcies they're now estimating, the impact of that is going to last a full generation. So the doctors are coming to me, the EMOs are coming to me, other politicians. I've had politicians, I'm now working with a series of groups of politicians, both federal and provincial, across many provinces, trying to find a way to get either to the Premier or to the Prime Minister to stop this. So yeah, there's a silent mutiny going on out there, but so far it's had no effect.
If you had a crystal ball, where do you see things in a year?
I can give you two paths. We leave the medical officers of health in charge. The third wave hits us in October, like it will. It's a seasonal virus. The new strains will come out, and the campaign of fear will continue, and we'll lock down a third time. And this time, we will completely crumble the economy of our provinces and our country. And at that point, it goes, I'm a guy who believes in confidence in government. You start ending up with revolution instead of evolution, right? People just become desperate. So that's one path. We leave the medical officers of health, and we ignore the science, and we continue down this path of using non-pharmaceutical interventions until literally the case count is zero, and it will get there. It's called summer. But then it will come again in October. It's called fall, right? The second path is we switch off of the medical officers of health in charge. The premiers reassert their control, go to a confidence-based response, and realize that the damage we're doing through the non-pharmaceuticals is 10 times worse than the other. And in spite of the fact that they might be pummeled by the public for the first 3 months, the public will catch on when we have 3 months to change the campaign of fear. And when the next wave comes next October, people will be told hospitals are ready, and oh, by the way, you're not at risk, only people with multiple comorbidities, and we have a plan to deal with them. And here it is. One of the things that we should have done in March, we have a pre-written plan, right? Reason we do that is so you can immediately and quickly, you take that plan, you adjust it for the actual disease, because the pandemic plan was written for any old pandemic. You focus it in on COVID. We knew who the target was for this disease. Could have been different for a different disease. But for this disease, it was people over 60 with multiple severe comorbidities. So we take the plan and we tailor it, and in the plan we put in the isolation of long-term care homes, we put in the plan for dealing with people not in long-term care homes, all the rest of that. And you actually publish it through the media to every member of your jurisdiction. Let's use Alberta. The Premier of Alberta writes a written plan that not later than the 15th of March, we saw this coming in February, we take the pandemic plan, we bring the emergency management team together, we bring all the 10 major departments that are going to be involved. One of them is health, but there's a whole bunch of others. You write a plan. You issue it through the press to the public. Then the public knows exactly what the plan is by phase. What are the triggers to move between phases? They know exactly why they should have confidence in government and what the government's going to do for each type of thing that could happen. And there's a page in there that says, and this is how you give us feedback. You got a better idea? Tell us. Instead, everything's been a surprise. There's been no published written plan. Nobody has a clue what the government of Alberta is going to do from one day to the next. And it's pretty clear they don't either, because the medical officer of health is making it up day by day as things happen. I take you back to the meatpacking plant, the abattoirs that had the outbreak. It came as a complete shock. Let me describe the livestock industry. It's no-brainer. Whole bunch of cow-calf operations, abattoir, all your stores, right? It's a venturi. And in every system we've got, whether it's agriculture, energy, there's venturis. We know what those are. We have lists. They're classified. We don't tell the public. But we have lists of what the critical infrastructure in every province in Canada is. As soon as we saw COVID coming, the worry is too many people get sick from COVID and we can't keep that venturi running. Not, there's one person sick, we send everybody home. That's ridiculous. And all the non-pharmaceutical interventions said you never send healthy people home. But that's what we did. So when one of our livestock venturis had the big problem last spring, what did the medical officer of health do? I never saw this coming. It came as a complete surprise. It shouldn't have. We knew they were a venturi. Are you kidding me? We sent everybody home for a 2-week lockdown. So suddenly we lost meat in our industry. How many other critical infrastructures could have collapsed like that because nobody even bothered to look at them? But that one should never have been closed. What you do is you have a surge capacity. When too many people get sick, you send more healthy ones in. Yeah, you develop some ways to try and limit the spread in that individual facility, but you don't close it. You never close your critical infrastructure. You sustain it, right? You build surge capacity. If that facility is considered too dirty, you move that production to a different facility, a temporary one, because you built a temporary one in case you lose any one of your critical infrastructures, right? That will get you through a very short period of time till you can clean that one and get back to work, 3 days, right? You never allow your critical infrastructure to fail. How dare we? We know in the electrical power grid, we know in the natural gas supply system, we know in the food supply system that there are vengeries. And yet every time it came as a surprise. If you had actually done what you should have done, had all 10 sectors that make up the economy in a room in February, this is coming, if it comes, because everybody was saying it might never come to Canada, but if it comes, we need to have a plan. Let's write the plan, and if it gets to Canada, we're going to issue the plan immediately. Then every Albertan knows their role, they have confidence in government, and they can see exactly how they're going to get out of this pandemic all together. Not picking winners and losers. Because I'm telling you, the people that are at home dying of the heart attack don't think they're in on this altogether. They're too terrified to go to the hospital, and they feel alone and isolated. I believe politics has taken over, and I don't know if I should say this on camera or not, but when I'm doing presentations with doctors, with EMOs, with the public, I say these 3 words. First, there's incompetence. The incompetence of our premiers. When every premier is sworn into office, the first thing they're done is they're given a massive briefing book. And you go through a whole series of briefings with your premier. One of them that every premier in our province got was from their EMO on how to handle emergency. They didn't go back to their briefing book, and they didn't have their chief of staff call the EMO into the office and say, it's an emergency, you're the emergency management officer, give me some advice. They didn't do that. Or if they did, they ignored it. So incompetence. So first of all, they didn't go back to the briefings they had been given. And secondly, then they chose to put the medical officer of health in charge. You never do that. In a forest fire, do you put the firefighters in charge of responding as 6 communities burn to the ground? Use Fort McMurray as an example. Were the firefighters in charge of the response in Fort McMurray? No, they weren't. The EMO was. Why? Because the firefighters are too busy fighting the fire and trying to figure out where it's going and trying to bend it to make sure it doesn't hit the 6 other communities beside. The EMO takes care of making sure there's still food in the town that's about to be burned to the ground, warning the town when it's time to get ready to pack up, working with the emergency management officer who is trained and living in that town by the Act in Alberta. We have one. He's there. Telling him this is what you should be doing with your community, make sure your mayor is involved, and then sending the trigger to say, get out of town. And then, when the town burns to the ground, starts the immediate recovery to build the town back, to move the people back, to keep them advised when they can go home. That wasn't the firefighters. The firefighters did none of that. So why do we believe the medical officer of health should run a pandemic? Their job is to ensure that the medical system is sustainable through surge capacity if required, that they give good advice to citizens on what they can do to help themselves to stay healthy, to make sure that we tell citizens when they're not at risk, i.e., all of the population except those over 60 with multiple comorbidities, and why they're not, because of data from the world, right? We're not just saying it, we're backing it up with real data. And then managing the vaccine plan when it comes, but to be constantly monitoring and watching for variants to watch for zoonotic behavior, to see if COVID's jumping into our cattle and our chickens. And you saw what happened in British Columbia. Oh my goodness, somehow it got into chickens. What a surprise. Happens all the time. Why was it a surprise? We should have had a specific unit monitoring it. Okay, so all these things that should have been in that written plan that we issued right at the front. They weren't because we've never had a plan. Incompetence at the start. The premiers, number 1, not going back to the briefing book they had, and number 2, putting the wrong person in charge. Then hubris. Once you've made the mistake, you're never going to admit. You're going to make sure you keep doing what you're doing because your poll numbers are going up, which is number 3, which is self-gain. We saw the Prime Minister of Canada realized within 2 days that every time he handed out $1 billion to encourage people to lock themselves in their houses, his poll numbers went up 0.5%. He kept doing it until he got 10%. He spent $254 billion to tell people to lock themselves in their homes. Not anything to do with, economic recovery, mental health. So I'm talking $254 billion, it's reported in the press, to tell people to lock themselves in their homes. And he gained 10 points in the polls. We took about 20 million people in Canada, make up our workforce. 8.9 million of them, at the peak, were either on CERB or a wage benefit through their employer. We took half our economy, half were still working, but we took half our economy and hid them in their houses from a disease that probably for 99.9% of them, because they didn't have severe comorbidities and they weren't over 60 years old, had almost a zero chance of dying of COVID. And at worst might have had a severe case of COVID in 1% of them.
Do you think some of this other problem, again, I don't know where you land on this, is a problem with the public in that maybe a huge percentage of the public don't want to work?
I would say that maybe is a 5%, okay? When I was in the Army, I was, through experience, learned, every battalion I took command of, I had 3 commands in my career, one of 1,000, one of 800, one of 500. And I learned really quickly that 5% of any group of individuals are evil, pure evil. My job as the CO was to find them and throw them out of the Army. 80% of my soldiers were really good, and I mean really good. And no matter what I did, they were going to be really good, right? And I wanted to spend more of my time with them and have fun with them, but I was always having to worry about this 5%. So there's 15% that I haven't accounted for. So 15% of every battalion I ever commanded were watching me. And if I let the 5% get away with the shit they were trying to pull, that 15% would go with the 5% and try and get away with it too. The 80% just carried on doing their job. They were great soldiers, men and women, doing what they did, and we're very proud of it. But that 15% would slide either way. And if I severely dealt with the 5%, that 15% shifted right back over with the 80%, and you have a battalion with good morale. But if you let that 5% get away with what they're doing, the 15% goes with them. And once you got 20% of a battalion that's unhappy, the 80% go to ground. They shut up, they go to ground, they still do their job, but they don't talk, they become sullen, and they, until you, because they see these guys getting away with, guys and gals getting away with murder. Okay? I think that's what, I've experienced that in my life in the Army. I believe that happens in society exactly the same. So there's 5% that are going to take every advantage they can in COVID, and they're going to apply for CERB even if they don't need it. They're going to do whatever, because that's just who they are, right? You're not going to change them. But it's the 15% of society, because I think 80% of the Canadian public right now is just waiting for this to end. Can we at least go back to a real life and really get but they're seeing this 20% having their way. The Twitter feeds, the Twitter crowd that are constantly screaming for lockdowns longer, harder, and deeper, right? Do you know the First World War at all? Battle of the Somme? The Battle of the Somme started on the 1st of June, ended when the snow fell in the fall. The best military minds in the world, and I'm going to use this as a parable, exactly not a parable, but an exact metaphor. The generals believed on the first day of the Battle of the Somme that if we shot a mass amount of artillery for 24 hours, that we would kill all the Germans and we would simply walk through their lines. Well, the first day didn't turn out that way, and we killed 100,000 soldiers minimum, and they were machine gunned to death because when the artillery came down, the Germans went in their foxholes and waited for the artillery to stop, came up, manned their machine guns, and killed us all. So a week later, they said, okay, we didn't use enough artillery. Let's use more. So we tried it again, and it killed another 200,000. 2 weeks later, we said, okay, we need to start earlier, use more, and shoot longer. And they kept trying to find that perfect mix of artillery till they'd killed over 1 million men, and the winter snows stopped the lunacy. Let me tell you that that's exactly what we're doing in COVID. If only we had locked down sooner, locked down harder, and made it last longer, we would have had less deaths. And we tried that in March, and we tried it in April, and then we tried it in October, November, December, January, February, and we're trying it again with the new variants, exactly the same. Maybe a little longer, maybe a little harder, maybe a little deeper. And we still keep killing all our seniors over the age of 65 with multiple comorbidities in long-term care homes. It's exactly the same because it seems to make sense. If you use a shitload of artillery, you'll kill all the Germans. It really makes sense. If you lock down harder, you'll stop the spread. It really makes sense. Only it doesn't work. In both cases, it simply doesn't work. So you don't look at evidence. You just follow a belief. And the belief is lockdowns work. It's become a religion. Belief in lockdowns work. So going back to the population, 5%, you're damn right. They're going to take advantage of this. 80% are just trying to get through it. And remember, half our population is still going to work every day, just like normal, right? Even at the peak, 8.9 million out of 20 million, the other 11 million were going to work every day. So they're not feeling it economically and well, they're feeling it mentally and socially. It's a less of an impact. But that group in the middle, that 5%, they're going to milk this for all it's worth, and there's 15% have jumped on that bandwagon because now we're hearing about long COVID, and we're hearing about all the different ways that you might be able to use the system to get more. Let's talk about long COVID. Long COVID exists on social media. Okay, and long COVID being, I've had COVID, I'm never going to get over it, I have terrible symptoms. Do I believe in long COVID? Absolutely. I believe that just the same as pneumonia, there will be people who get COVID, just like when people get pneumonia, who have pre-existing serious conditions and will continue to have COVID problems for the rest of their lives. They will be. It'll be a very tiny number, but there will be people that have this. So do I believe in it? Absolutely. And some people who've had no comorbidities, their body, for some reason, COVID's going to win, okay? And it'll stay with them forever. But there have been studies of over 500,000 people who have recovered from COVID. Now, first of all, to call it long COVID, it has to last longer than a year, and COVID hasn't been around for a year yet. So you can't call it long COVID yet. But out of that study of 5,000 people, they've found less than 1.5% after 6 months have any symptoms. And yet on social media, you would believe, over here in the 5%, you would believe that long COVID is a huge problem and is going to impact 45% of our population. That's based on a report that was done coming out of Italy back 1 month into the first wave, and a follow-up report that was 3 months after the first wave that said we're finding up to 45% of people say they have some form of symptom, but we haven't been able to test if they had pre-existing conditions with these symptoms. That was the report that Johns Hopkins put out. 45%. And it said up to, it said, seriously, we found less than 2%, but up to 45% may have, based on pre-existing. The studies that are coming out now in December and in January, mass studies from across Europe, from across, everyone seems to be recovering except for a very small, up to 1.5%, who have some form, and some form normally based on a pre-existing condition. But you wouldn't believe that from watching social media, so we're back to the 5%, right? That will use this and will find a way to stay on long-term benefits for the rest of their lives, and we'll let them, because that's how society works, unless we actually put a regulatory framework in place. We certainly didn't even try to do that when we handed out CERB and all the employment assistance and all the rest of that. The idea was to pour the money out of the door to justify the lockdowns.
How urgent is the message you have for the public?
To me, I watch every night, and I see that across Canada, we add between 100 to 200 more dead seniors. To me, that's unconscionable. I simply can't live with that, and that's why I keep writing. It's extremely urgent, because until we quarantine all our seniors in long-term care facilities, and just for a number, based on the information from the Government of Canada, there's 2,039 long-term care facilities of all types, profit, non-profit, in Canada. It's not a huge job. It's not hard to do, especially when you break it down by province. Until we stop the seniors dying, I can't live with myself as an emergency manager, because I know we're not doing the number one thing, protect those most vulnerable. So to me, it is an immediate concern, but far more, a much huge, because the vaccines are now getting into long-term care homes, and it's probably going to take to the end of March to just vaccinate the residents and the staff in long-term care homes, not the rest of the public, just those people, if we actually make them the priority, and some provinces haven't. But if we make that the priority and we deal with that, assuming that the shifts in the viruses aren't going to kill them again, okay? Because we got to be watching that. The damage we've done, in terms of mental health, in terms of other diseases, to the education and the social development of our kids, to the economic impact on all of our industry and our business, and to those other severe diseases where people are dying every day, that to me is unconscionable. So unless we shift now, that's going to continue. And if we don't think that we need an immediate plan for each of those other 5 areas, now their deaths will mount exponentially. So I believe this is an immediate problem, and it has to be addressed immediately, and we need at least one premier to show all the rest how to shift. Quarantining means staff and residents, and no one else is allowed in. The best stories I've heard from across the provinces is we've stopped healthcare workers from working at more than one facility, but they still go home at night to their family and come back with COVID and kill the seniors. It was no risk to them, but it's killed the seniors, right? A quarantine means nobody in, nobody out, nobody dies. In France, in the middle of the first wave, in the largest hotspot in France, and all you have to do is type in Victory, France, COVID, long-term care home, and you'll immediately get it. It was a CTV article. There was a group of people that for 47 days said, we're not going home. They simply chose not to leave. They loved their residents too much, so they had not sleeping bags, mattresses delivered into the home, and they lived with the residents for 47 days. They had the food delivered to the front door, they scrubbed it, all the rest of it. They brought in massive games and entertainment systems and communication systems so that there could be daily communication with family, and they stayed locked down for 47 days and lost 2 residents, to heart attack and another disease. No one died of COVID. That's what a quarantine really looks like. What we've done here in Canada is said, oh, you can go home at night, but you can only work in one facility. And that's coast to coast. That was the response. Some people got lucky, most didn't, right? And so when Doug Ford actually said on March the 30th, we're going to build an iron ring around our seniors, I took that as meaning they were going to quarantine long-term care homes. That's not what he meant. He meant he was going to throw a bunch of money at seniors' policies. When in January, they admitted they had 40% of all long-term care homes in Ontario were having an outbreak of COVID. You can't tell me they were quarantined. 40% of their long-term care homes, and they had mass deaths. Look what happened in Quebec in the first wave. Those weren't quarantined. They weren't quarantined until the military showed up. And the military knows what a quarantine looks like, and they quarantined them. And that's when the deaths stopped in Quebec in the first wave. And then they went right back to it in the second wave. Quebec, in fact, represents half of the deaths in Canada. Out of that 20,900, Quebec is over 10,000. Almost all, they only have 2.5% who are not over the age of 60 with multiple comorbidities. That's who it's killing. And so half of the deaths in Canada happen in Quebec to their seniors. And you would have thought they would have learned from having to call the military in the first time, but they didn't. They went back to a system where people could come in and out, where deliveries happened, that's not a quarantine. But you can, if you want to. I've seen some examples in the rest of the world, innovative people. They've got those giant plastic hugging walls with the 2 armholes that go each way, and the family member comes up and the senior comes up, and through the big, they hug each other and they kiss each other through the plastic, and they talk about their day, and they have a place where they can sit, and they have viewing rooms where they, full glass, not like a prison people, where they talk and they have really good communication. They bring extra games. They bring entertainers in. Entertainers that are quarantined and go from long-term care home to long-term care home to long-term care home for 30 days. Fully quarantined for 14 days before, and they come in and they provide live entertainment in the long-term care homes for those that are, wanting to attend it. There's so many ways you can do it. We haven't done that. Otherwise, I wouldn't be seeing over 200 deaths a day in long-term care homes every night on my TV.
If you had the chance, if we can get this film in front of the premiers in front of at the PM office, what would you say?
I would say, please let us help you. We've been begging to help you, both the doctors and the EMOs who aren't medical officers of health. Let us help you. Please let us help you. We know how to run an emergency. We know how to write in a plan. We know the process to bring all the right players, all of industry, all of the private sector, all of the public sector together in order to manage this emergency and to stop doing what we're doing and to make Canada a role model rather than the place you don't want to be.